My name is William Patterson. I'm an orthopedic surgeon with the Mizona division of OrthoArizona. I have a specialty in shoulder replacement, but I do see patients of all types with all sorts of orthopedic problems, all ages. I went to medical school in Chicago at the Chicago Medical School. I did my orthopedic surgery training in Memphis at the Campbell Clinic, and then I did an extra year of training in shoulders in Dallas. One of the shoulder procedures that I really do enjoy doing is a shoulder replacement surgery. And in general, there's two different types of shoulder replacements. There's a standard total shoulder replacement, and then there's something we call a reverse total shoulder replacement. So the patient who is a good candidate for a regular shoulder replacement has basically standard shoulder arthritis in the main ball and socket joint of the shoulder, and no other muscle or tendon tears around the shoulder. These people typically do very well if they've already failed things like taking medicine for the pain. Sometimes people have tried physical therapy. Sometimes we'll do a steroid injection. Once all that stops working and your shoulder keeps you up at night and just makes your life miserable, then that's the time where you should consider having the total shoulder replacement. Most patients who end up having a total shoulder replacement are probably in their 60s or 70s, but even people who are younger than that with very bad shoulder arthritis who have had other treatments that just don't work are candidates for this. The shoulder replacements that we're doing these days, we expect them to last at least 15 or 20 years. People who have a job that involves a lot of upper shoulder labor would probably wear out their shoulder replacement sooner. So the patients who are better candidates for the reverse shoulder replacement typically have either had surgery that has failed in their shoulder, or they might have some muscle tendon tears, some rotator cuff tendon tears, or if they've already had a total shoulder replacement and that surgery has failed. So the reverse shoulder replacement actually replaces the normal ball of the shoulder with a socket, and then the normal socket of the shoulder with a ball. And what that does is it allows your shoulder to function using just the big deltoid muscle on the outside of your shoulder, even though you might have the rotator cuff tendon tears. So it still allows the shoulder to move quite normally, even though you might have these other problems in and around the shoulder joint. So typically when people have either a total shoulder replacement or a reverse shoulder replacement, they'll be in the hospital at least overnight. Sometimes people stay for 2 or 3 nights. We just want to make sure that you're doing okay with your pain control and there are no other sorts of complications with the surgery. You'll be in a sling for a total of 4 to 6 weeks, and then you'll be getting into physical therapy usually about 2 or 3 weeks after the surgery. The physical therapy is one of the most important things, and that usually goes on for at least 3 months after the surgery. Typically, by about 10 to 12 weeks, most people are able to raise their arms overhead, and usually it takes about a year or so to gain full recovery from the surgery.